Hi everyone, my name is Eunice Lopez. I am a public health education specialist with Butte County Public Health, and today I'm going to talk to you about COVID-19 basics. So throughout this presentation, I'll talk about what the virus is, how it's transmitted, and how we can take steps in our county to lessen that transmission. So the culprit is COVID-19. It is a virus, and it is a novel or new coronavirus that has not previously been identified. And to help give us a better understanding of this virus, I'll break down what COVID-19 means. So the CO in COVID stands for corona or corona, which in Spanish means crown, hence the crown-like spikes you can see in the image there. The VI stands for virus, D is for disease, and 19 is for the year the virus began to cause disease in humans. And that's how we get COVID-19. Now, while the exact source of this virus is unknown, we do know that COVID-19 comes from a large family of coronaviruses that are common in people and different species of animals. We also know that this virus's effects are being experienced on a worldwide level, therefore it's classified as a pandemic. As far as transmission goes, the virus that causes COVID-19 is thought to primarily spread from person to person, mainly through respiratory droplets that are produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby and can even be inhaled into their lungs. Spread is far more likely to happen when people are in close contact with one another, so within 6 feet or less. It is also possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth or nose or even their eyes. This isn't thought to be the primary way the virus spreads, but it is definitely a possibility. At this time, the risk of COVID-19 spreading from animal to human or human to animal is considered to be low. Individuals who have tested positive for COVID-19 have experienced a wide range of symptoms. These symptoms have been reported as being mild to very severe and can lead to illness or death. This list does not include all possible symptoms. Again, we're learning more about the virus, so this list can change. But as of now, these are the ones that have been reported the most. Symptoms may appear 2 to 14 days after an initial exposure to the virus, and I'll discuss that time frame in a couple more slides. It should be noted that some individuals may become infected with the virus, but will remain asymptomatic or without symptoms during their infectious period. Really, the truest way to know if your symptoms are COVID-related is to get tested with a nasal swab that detects for the virus. While everyone is at risk for contracting the virus, there are certain populations that are at higher risk for developing severe illness from the virus. These two groups include older adults, so people who are 65 and older, as well as people who are living in skilled nursing facilities or long-term care facilities. The second group includes people of all ages with underlying medical conditions, particularly if those conditions are not well controlled. And some examples of these include chronic kidney disease requiring dialysis, chronic lung disease, serious heart conditions, severe obesity with a BMI of 40 or higher, diabetes, liver disease, as well as individuals who are smokers or vapors. This also is the same for those who are immunocompromised. Currently, children do not appear to be at higher risk for COVID-19 than adults. Although some children and infants have been sick with COVID-19, adults still make up the majority of the cases known to date. So, how do we protect ourselves and others? Well, there's a lot of easy best practices that we can take to help protect ourselves. These include, but are not limited to, washing our hands with soap and water for at least 20 seconds and washing them often. If there's no soap or water available, you can use a hand sanitizer. You just want to make sure it has an alcohol content of 60% or more. We want to avoid close contact with individuals, so practice social distancing. We want to remain that 6-foot distance from other individuals. We want to make sure we're not gathering in groups, we're staying out of crowded places, and we're avoiding mass gatherings. We also want to make sure that we are maintaining this distance between ourselves and individuals who are at higher risk of getting very sick. So those two groups that I mentioned in the previous slide. We want to make sure that we're wearing a face covering while we're in public or around people who are outside of your household. And an important thing to remember here is that these face coverings are really helping protect other people in case you're the one who's infected. If you'd like to learn more about how to properly wear a face covering or how to even make your own, you can visit our Butte County Public Health website. Additionally, some best practices include covering our coughs and sneezes, cleaning and disinfecting frequently, staying at home if you're sick, monitoring your health, so knowing those symptoms. And really, all of this is very important to do because there's currently no vaccine to prevent the virus, so it's up to each one of us to use these best practices and remain protected, as well as protect others. So what's the difference between a case versus a contact? Well, a case is a person with a confirmed positive test or someone who is strongly suspected of having COVID-19 based upon medical evaluation. They may be symptomatic or they may be asymptomatic, but they will be asked to isolate. A contact is a person who was in close contact, so 6 feet or less, with the confirmed case for a prolonged period of time. And as of now, prolonged is defined as 15 minutes or more. And this person will be asked to quarantine. There's also a difference between isolation and quarantine, and it's important to know the two. So a case will be asked to isolate from the time that COVID is suspected, which is usually the day they've been tested, until at least 10 days have passed and they've gone 72 hours with no fever, without the use of fever-altering medications, and where they've seen significant symptom improvement. If a person tests positive and doesn't become ill or show symptoms, they'll still remain in isolation for 10 days from the time they were tested. This time frame can vary from case to case, so Butte County Public Health staff will help determine what that time frame is for each person. Someone in quarantine will remain at home where they can be away from other individuals for the length of 14 days after the date of their last exposure to a case. So, for example, if I was exposed to a case on July 1st, I would remain home and monitor for my symptoms through July 15th. And then on July 16th, I would no longer be in quarantine. If at any time during my quarantine I became sick and tested positive for COVID-19, then I would become a case and would need to isolate as I just described. Again, Butte County Public Health staff will provide guidance on how to isolate or quarantine and for how long. Another great part of what we've been doing is known as contact tracing. And the way this works is that during case investigation, public health staff will work with the case to help them recall every person they were in close contact with during the time frame where they might have been infectious. Public health staff will then begin contact tracing by calling these individuals and warning them of their exposure to the case as quickly and sensitively as possible. Privacy and confidentiality are maintained during this conversation, so contacts will only be informed that they have been exposed to a case, but they won't be told the identity of that person unless that person has given permission to do so. During this conversation, contacts are provided with education, information, and support to understand their risk, what they should do to separate themselves from others who are not exposed, and how to monitor themselves for illness. Contacts are informed that they need to stay home for 14 days, and the reason why it's 14 days is based on what we know from other coronavirus infections. 14 days is the longest time between when you were last exposed to the virus and when symptoms can begin. Again, Butte County Public Health staff will help set that time frame for you. During this conversation, individuals will also be asked if they want to sign up for the text illness monitoring program. And the way that works is if someone agrees to be signed up, their number will be put into the system and they'll receive an automated text message on their first day saying, "Hi, welcome to the program. Please respond with yes or no to the following question." And then they'll be asked if they are symptomatic. If someone responds with no, they'll receive another text saying, "Thank you for your response. We'll reach out tomorrow." If they respond yes, they'll get a text message saying, "Thank you for your response. Someone from your local health department will reach out to you soon." This is just a really great way to keep tabs on everyone who is a contact to a case. There are a couple of options for testing, and these include 2 viral tests known as the nasopharyngeal test or the nasal or nares tests. And both of these are viral tests. They are not serology tests. And the reason why we're recommending a viral test and not a serology test is because viral tests will look for COVID-19 virus in the specimen and will let an individual know if they have a current infection. Whereas a serology test or an antibody test looks for antibodies in the blood and might let you know if you've had a previous infection. So this test is not recommended for use in diagnosing, but it is absolutely helpful in terms of vaccine research development. As you can see in the images, there are some differences between the 2 tests. The nasopharyngeal test will be administered by a healthcare professional. They will insert the swab through your nostril until they reach the nasopharynx. It is mildly uncomfortable, but the results are very accurate. The nasal swab or the nares test can be self-collected with observation by a healthcare professional. It's a bit more gentle and less invasive. So you're probably wondering, well, where can I get tested? We are very fortunate in our county to have lots of locations that we can go to get tested. These include, but are not limited to, your private provider. If you choose to go that route, and if your private provider is offering testing, you want to make sure that it is a viral test and not the serology test. Ambla Health in Chico, Oroville, and Gridley are offering testing by appointment. It is available to all ages. CBS started doing drive-through monitored self-collection, and the way it works is you make an appointment, and while you remain in your vehicle, you'll be given the swab, you'll collect your own sample, and then you'll hand it back to someone. You must be 18 years or older to get testing done at CBS, so keep that in mind. And the last one there on our list is the OptumServe site at the Silver Dollar Fairgrounds. This is a really great option for most individuals. You can go there if you are a probable case, if you are a close contact to a case, if you're feeling sick, or if you're asymptomatic. Undocumented individuals can go, those who are experiencing homelessness, as well as those who are underinsured or uninsured. They are open Monday through Friday, 7 a.m. to 7 p.m., and it is available for all ages. So if you'd like to make an appointment, you could visit their website there or call that 888 number. Butte County Public Health does strongly encourage that all contacts to a case, all essential workers, and individuals who are just not feeling well go get tested, even if you are asymptomatic. I'd also like to encourage everyone to continue to stay informed. As I mentioned, we're still learning a lot about this virus because it is a new virus. So staying up to date on information is really important. That last website there is our Butte County Public Health website. And the great thing about visiting our website is that you can stay up to date on local information. So if you log in and scroll down the page a little bit, you'll come to this dashboard here. And if you click into it, you'll be taken to another page that has some information as to what's going on in our county. So you can see here a total number of confirmed cases, how many viral tests were done, and who's where. It also breaks down our cases by age, as well as by region in our county. So this again is just a great option if you want to stay up to date and know what's going on in our county. This page is updated by 4 p.m. Monday through Friday. I'd also like to encourage everyone to help stop stigma in our community. We want to be mindful and respectful when we are speaking of COVID-19, especially in regard to stigma that is aimed towards our Asian American and Pacific Islander community members, those who are in quarantine or isolation, individuals who choose to get tested, as well as individuals who choose to wear a mask to help protect us all. So thank you all for tuning in. I hope this was informative for you. If you have any questions, you're welcome to reach out to our Butte County Public Health website. And also make sure that you're checking in there for the latest information. Thank you for helping our community stay safe.